former First Lady of South Africa. You are all welcome to Ghana. Distinguished representative of the First Lady of Nigeria, Honorable Ministers of State, the Executive Director of UNAIDS, President of the Elizabeth Glaser, President of the Society for AIDS in Africa, Assemblies of God Women's Group, Executive Secretary of OFLAD, members of the Diplomatic Corps, Civil Society Organization, Nananum, Chiefs and Queen Mothers, members of the media, welcome you all to the First Lady's high-level side meeting on ending AIDS in children and mothers by 2030. And the wonderful people of Ghana are honored to host this year's ICASA, which has provided us with a platform to continue shaping Africa's health and development. This presents of the most pressing health priorities affecting our continent, safeguarding the health and dignity of mothers and children across Africa. Your Excellencies, the power of this conference lies not in our title, but in our shared determination to translate our advocacy into action. As First Ladies, we carry a responsibility to elevate the newborns who are vulnerable to healthier life. Despite notable progress in recent years, the syphilis and hepatitis B during pregnancy, childbirth, and breastfeeding. These infections can lack access to quality antenatal care, early testing, and life-saving treatment. According to UNICEF and WHO, mother-to-child transmission rates can be reduced to below 5%. However, it requires a combination of political will. Such is not just a health challenge, it is a text of our collective commitment. Distinguished guests, through the Organization of African First Ladies for Development, we have established a strong movement of compassion and advocacy. Our united voice as First Ladies has highlighted the urgency of maternal and child health on the health agenda in our respective countries. It has mobilized resources, strengthened political commitment, and advocated for community-based solutions. This platform shows that when we unite, we have worked towards the goal of universal access to maternal and child health services. My office, in partnership with the Ghana AIDS Commission, has carried out extensive community medical outreach program in Accra and other regions of the country. Through these initiatives, women, young people, and families have received free screening for HIV and other conditions, comprehensive counseling, Ghana Medical Trust Fund, known as the Mahama Cares Initiative. This program will expand access to healthcare by addressing health issues often overlap and demand coordinated responses. These efforts demonstrate our strong conviction that quality primary health care is not a privilege for few, but a basic right for all. Your Excellencies, we look forward to hearing about your experiences and interventions in your respective countries. However, allow me to say that achieving the triple elimination agenda, which is elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B, demands more than clinical interventions. It requires, one, consistent and sustained financing to strengthen fragile health systems, effective community engagement that reaches the last mother and child in even the smallest rural village, a brave attempt to fight stigma that stops women from seeking care, empowering women and girls to make informed decisions about their health and futures, mothers and children, and a strong political leadership that prioritizes maternal and child health in national development. Ladies and gentlemen, no child should be born carrying an infection that could have been prevented. Safeguard her health and ensure her baby's future. These are not just aspirations. They must be our exchange experiences, build stronger partnerships, renew our commitment, and outline a clearer path towards 2030. The road ahead requires honest dialogue about what is working between policy and practice, and all our development and civil society partners for their firm leadership and technical support. The knowledge, commitment, and action plans arising from today's discussion will influence the health outcome of millions of African mothers and children. Let us leave Accra united in purpose and confident in action. Let us ensure that our advocacy results in accessible clinics, affordable medicines, trained health workers, and empowered communities. We must work towards celebrated without fear. And ladies and gentlemen, to borrow from my husband's campaign message, we must build Africa. Thank you, Your Excellency, for your leadership and dedication, and for joining us here in Accra.
Thank you very much. Her Excellency, the First Lady of the Republic of Ghana, one understands the heartbeat of our politics and our governance more than even presidents, watching, learning, acting from within and from without. Please, let us give her another round of applause. But if you don't listen, you won't go out for lunch. What are we eliminating? I'm catching some people reading from the screen. What are we eliminating again? And turn to your neighbor and tell them what you're going to do as your personal commitment to the cause. Madam Joyce, turn to Madam Marietta and tell her what your personal commitment to the cause is going to be. Fair. May God help us achieve this goal within the shortest possible time. Ladies and gentlemen, let's give ICASA a round of applause. Let's also give the Office of First Ladies a round of applause as well. And let's keep the applause going as I welcome the First Lady of Sierra Leone. Applause, ladies and gentlemen. Let's welcome our beautiful First Lady to the podium.
Thank you. I don't know how you get to beat Madam Mahama. So Ghana, bear with me, please, and help me put your hands together again for our dear host. What technology does. Her Excellency, Madam Lodena Dramani Mahama, First Lady of the Republic of Ghana, and our dear host, let me start by thanking you very much for convening First Ladies into Ghana for us to have a conversation. my dear sisters, First Ladies of Africa, of Kenya, the former ministers here present, members of parliament here present, ambassadors and members of the diplomatic corps, our traditional leaders, and our queens of Africa, distinguished guests, members of the Fourth Estate, ladies and gentlemen, good morning. I bring you warm greetings from my dear sisters of Oflad and from the resilient, beautiful people of Sierra Leone. It is an honor to stand before you today at a history where no mother loses her life, giving birth, and no child enters this world burdened by a preventable infection. The vision we carry, ending AIDS in children and mothers by 2030, is not just a target. It is a promise, a moral promise to our continent, to our daughters, to our sons, and to generations yet unborn. As president of Oflad, and I speak with deep conviction, this role has shown me the face of vulnerability and the face of courage. It is the face of a must-hand the courage of the African woman who does not give up on her dreams, the health worker who serves with compassion even when resources are limited. These faces are my mission. They are our shared responsibilities. Rise, entire nation rises with us. Together, we have shown what compassionate leadership can achieve when driven by purpose and unity. Allow me to celebrate three pillars of our impact. Elevating political will. We have pushed maternal and child health, HIV, syphilis, and hepatitis B to the center of national antenatal and life-saving treatments. Mobilize reach. In villages, chiefdoms, broken silence, shatter stigma, and replace fear with hope. In Sierra Leone, I have seen mothers walk proudly into clinics that save lives, working with strengthened health systems, supported national campaigns, and expanded integrated services. Partnership is our power, and through it, Africa has moved closer. Political commitment means nothing without sustained investment. Integrated service gives mothers dignity, one door, one journey, one continuum of care. Stigma is a silent killer, one we must defeat through relentless community engagements. And above us, these lessons tell us one thing: progress is not accidental, but progress is intentional. As we advocate towards 2030, Oflad stands ready to lead with renewed courage, guided, championing universal access to high-quality PMTCT and triple elimination services, advocating for full integration of HIV, syphilis, and hepatitis B services in maternal and primary health care, empowering communities to eradicate stigma and ensuring no woman, young or old, accelerating life-saving innovations in early testing, treatments, and vaccines. Our call to action not beyond our reach. Africa has everything. We remain in our sheer resolve as president of Oflad and as the UNAIDS champion of adolescent girls and young women. I reaffirm our commitment to every girl who dreams, to every mother who hopes, to every child who deserves a healthy start in life. I pledge that our girls will not be forgotten. As an African woman, I pledge that I will continue to fight until every child is born healthy and every mother thrives. Let us rise together with courage in our hearts and determination in our actions to build an Africa where every child is born healthy and every mother thrives. At this juncture, permit me to say thank you to Madam Winnie for your endless championship in making sure our young girls in our continent understand what it means to be a woman and the job that we have to do just to survive. You have been the face of UNAIDS and you have transcended and break boundaries for women to see. I want to thank you and also thank our Executive Secretary, Dr. Naders, who in her own wisdom is able to put African First Ladies together, not because we are difficult, it's just that we are very hard to reach. Madam Mahama, for your generosity in hosting us in your beautiful country. Thank you. May God bless you all.
We can do another round of applause. Thank you. So now we are going to take a number of presentations and remarks from our First Ladies, and they will be meant and the future commitment. Allow me to welcome Her Excellency Mrs. Katumu Yata Boakai, First Lady of the Republic of Liberia.
My dear sisters, distinguished development partners, leaders of civil society here present, beloved sons and daughters of this beautiful continent, Africa, I bring warm greetings from the people of Liberia, the first birthplace of Pan-Africanism, Africa's oldest republic, which fought, and I also bring His Excellency Joseph Jomo Boakai Sr., a man who firmly believes that God is willing for the health of his mothers and the hope of his children. Today, we stand in Accra, the second birthplace of Pan-Africanism, the land of Nkrumah. We gather not to speak about Africa's future, but to fight for it. And so I say with conviction, if Africa could fight for liberation together, Africa can fight for healthy and AIDS-free generation. This I believe. This I believe transcends a ceremonial gathering, and this is definitely not a diplomatic routine. This is a summons to our moral responsibility, a call to protect the wombs that carry our future, the mothers who anchor our nations, and the children who represent Africa's tomorrow. May I re-echo this for swift action and be very clear. Like I always say at our other gatherings, we are not here for ceremonial speeches or diplomatic courtesies. We are here to affirm our collective commitment to speak with one voice and act with one purpose, that no child should be born with HIV. No child, I repeat, should be born with HIV. That no mother should pass on syphilis unknowingly. That no baby should battle hepatitis B from birth. Not in Ghana, not in Liberia, not anywhere in Africa. Let me be clear. Mother-to-child transmission of HIV, syphilis, and hepatitis B is evidently not a medical issue, development issue, and it is clear that one African child should enter this world already fighting for life. I say to you without a shadow of doubt, not one African mother should be betrayed by a system that was supposed to protect her. Not one baby should carry a burden that already has been defeated. During one of my recent hospital visits, a 7-year-old boy tugged on my dress. Stop being sick. His mother stood beside me, tears rolling down her cheeks. She whispered, she was born with what I did not know I carried, HIV. My dear sisters, this is why we must act with urgency. A child should never carry the burden of a system's silence. A mother should never carry the guilt of a system's failure. This is why, through my advocacy in Liberia, we have aligned our national priorities with the triple elimination goals. We are, one, antenatal testing concepts, training more midwives, nurses, and community health workers, mobilizing traditional and faith leaders to change harmful narratives, and engaging youth and civil society to break stigma, silence, and shame. Our commitment is uncompromising, but we know we cannot do it alone. No country uniting us beyond our borders, beyond our politics, and beyond our limitations. My dear sisters, we need strong collaboration, sustained financing, and united continental leadership. Let us remind ourselves, beyond every stylistic is a mother with a heartbeat. Beyond every percentage is a child with potential. When a mother buries a child, she buries a piece of our nation. When a child is infected at birth, all of us that in Africa, a mother's cry is never hers alone. It is a summons to the entire village. Allowed me to draw from the founding of our continental wisdom. An African proud poetry says, and I quote, when the roots are diseased, the branches cannot flourish, end quote. If we do not protect the health of women and without apology, the womb must never be a war zone. The birth of a child must never be a death sentence. And again, we cannot eliminate poverty. It is women with influence, not carry the scalpel, let us carry the story. If we cannot hold the microscope, let us hold the microphone. Our voices must disturb complacency and awaken accountability. I repeat, our voices must disturb complacency and awaken. When African First is advocate, may I remind the queens in this room, our platforms are not ceremonial, they are catalytic. Our influence is not symbolic, it is substantive. Our voices are not decorative, they are decisive. We are the mothers of this nation, or our nations. And mothers do not negotiate when it comes to the safety of their child, echo across Africa. So the daughters of Africa stood together and declared, enough is enough. By 2030, Africa, not by hope, but by action. Because when Africa decides, Africa delivers. Let me remind us of the powerful words of Nelson Mandela, who said, and I quote, "It always seems impossible until it is done," end quote. Any mother-to-child transition may seem difficult. Africa accomplished them all. My sisters, my colleagues, my partners, I am hopeful that we stand at a defining moment in history. Let us leave this place not as participants of a conference, but as guardians of a promise that every child born in Africa will begin life healthy, whole, and free. A promise that no mother's joy will be replaced by grief because of diseases we already know how to prevent. And so, I close with this declaration, a declaration worthy of our mothers, our daughters, and the Africa we are determined to build. Let it be recorded that when the future asks who protected Africa's children, history will answer, it was the mothers of Africa, the first ladies who stood together, rose together, fought together and delivered a generation born free, living free, and rising free. Africa's children are not stylistic. They are the future we refuse to fail. May God bless our efforts. May God bless Africa's mothers. May God bless Africa's children. And may God bless this beautiful and beloved continent together, today, tomorrow, and for generations to come. I thank you.
Wow. That was profound. Another round of applause. And when I hear profound things, I do a test. Who protected Africa's children when history asked? Who protected Africa's children when history asked? Didn't hear you. Who did? Indeed, and particularly, Your Excellency, we will raise our voices to disturb complacency and await the Lady of Sierra Leone another round, Liberia, beg your pardon, another round of applause. Mrs. Katumi Yata Boakai, please. Thank you so much for those provocatively. Another brilliant First Lady, Baro.
Boko. Your Excellencies, my dear sisters, First Ladies of Africa, our dear host, thank you for the hospitality and the best jollof rice. Madam, we won it the last time here in Ghana. The Executive Director of UNAIDS, the President, Society for AIDS in Africa, members of diplomatic and secretarials here present, members of the press, ladies and gentlemen, good morning. It is an honor of HIV and eliminating the newborn infections in Africa. This gathering reflects our sincere commitment to safeguarding the health and future of our continent's children. As a leading champion of the national efforts to end mother-to-child transmission of HIV, and as a proud member of OFLAD, I remain deeply committed to strengthening leadership and advocacy in our collective mission to eliminate new pediatric HIV infection. In the Gambia, thanks to strong national commitment and multi-sectoral partnership, we have made a significant progress in PMTC. Pregnant women receive counseling on HIV testing, and an impressive 98% of HIV-positive mothers were enrolled. We have also expanded early infant diagnosis, allowing us to detect infections early. Strategy investment, improve access to services in both public and private facilities, and sustain leadership from my office. As part of my efforts to advance PMTCT, I launched a nationwide HIV sensitization campaign, leading campaign across the country to providing testing, counseling, and awareness. These efforts have contributed to reducing stigma, promoting behavioral change, and increasing male involvement, an essential factor in sustaining treatment and experiences of people living with HIV can be more damaging than the virus itself. In relation to the triple elimination of HIV, hepatitis B, and syphilis, my initiatives have focused on mobilizing resources to strengthen antenatal care, produce essential commodities, and upgrading infrastructure. Maternal and child health hospital represent a major step towards in expanding equitable access to life. NAS, UNICEF, UNAIDS, and others to ensure national efforts align with the S partners. I hope that together we ensure that the Treatment Plus initiative, which empowers adolescent girls and boys alike with access to comprehensive sexual and reproductive health information, HIV prevention, gender-based violence, response to gender equality, promotion, and full initiative. Additionally, strengthening the capacity of Gambian health professionals, our health workers to pursue advanced training in infectious disease, HIV care, and neonatal health. Investments that are built through we have made adolescent and newborn babies. Most remain a top priority for all of us. Today, I reaffirm my commitment to ensuring that no child in the Gambia is born with HIV, hepatitis B, or syphilis. Every discrimination in all of these forms. Collaboration amongst stakeholders to work closely with the government, our development partners, civil societies, communities, and my sister African First Ladies to ensure that the Gambia remains firmly on track to ending AIDS in children and mothers by 2030. Thank you.
Thank you very much. Thank you. Another round of applause. We must work to end stigma. We would now like to invite to take her turn the First Lady of the Republic of Kenya, Her Excellency, Mrs. Rachel Ruto. With a round of applause, ladies and gentlemen.
Yon and Waflat President, Your Excellency Mrs. Lodina Dramani Mahama, First Lady of the Boakai, First Lady of the Republic of Liberia, Your Excellency Mrs. Fatumata Barrow, First Lady of the Republic of Gambia, Madam Tobeka Stasi Madiba Zuma, former First Lady of South Africa, Ministers present, Diplomatic Corps present, partners present, ladies and gentlemen, good afternoon. Good afternoon. Imagine a newborn in Ghana, born this very morning, healthy, hopeful, full of promise. This must end, not in 10 years, not in 5. We must end it. Gambians, as the conscience of this continent, to declare with one voice that no African child should begin life with a burden they did not choose. I bring you warm greetings from His Excellency President Dr. William Ruto, who reaffirms Kenya's commitment to strengthening maternal and child health, advancing HIV prevention, and supporting the shared vision of Africa, where every mother and every newborn begins life with dignity, and First Ladies for their steadfast leadership in this mission. Africa has come a long way, but we are not yet where we must be. In Kenya alone, data indicates that over 3,000 through mother-to-child transmission. And as a country, we did not meet the less than 5% elimination target. These numbers are AIDS Response Progress Report 2025, released on World AIDS Day, reminded Kenya, like many African nations, of the work that still lies ahead. The findings show that the mother-to-child transmission rate has risen above 9%, with Nairobi County recording the highest number of new infections. 7 out of 18 to 19. The most missed HIV testing, strengthened early testing, protect adolescent girls, ensure continuity of treatment for mothers, and accelerate the elimination agenda, particularly. The science is clear. The solution exists. What remains is leadership, unity, and moral courage, the kind that First Ladies across Africa have demonstrated for decades. As Gracia Machel said, preventing HIV in children is not a medical duty. It is a moral responsibility. Today, we stand together under that same conviction, committed to eliminating mother-to-child HIV transmission that strengthen this fight. Last week, 2 counties in Kenya, Kajiado and Narok, made a historic declaration to end female genital mutilation and child marriage practices that have long exposed young girls. This declaration, issued during the launch of the 16 days of national activism against gender-based violence, is a victory for the rights of girls. It is also a powerful step toward reducing new HIV infections among adolescents. To Africa and the world, that First Ladies are implementers, advocates, mobilizers, and protectors of the African family. And across this continent, we are witnessing extraordinary progress as Botswana and Rwanda nearing triple elimination, Namibia making bold strides in elimination outcomes, Kenya expanding antenatal coverage and prevention of mother-to-child transmission services through the Social Health Authority. We are proving powerfully that African-led solutions can reshape global health outcomes. Excellencies, Africa stands at a moment of profound possibility. We have drastically reduced new pediatric infections over the last decade. Countries like Botswana and Rwanda, as mentioned earlier, have shown every child born with HIV reminds us that we must move with greater urgency. Every mother who misses care compels us to strengthen our systems. Former OAFLAD President and former First Lady of Namibia, Her Excellency, is about dignity, justice, and the value of every African life. Her words still guide us today. Ladies and gentlemen, Kenya remains firmly committed to the triple elimination of HIV, syphilis, and hepatitis B. We are strengthening antenatal care, expanding testing, improving treatment access, and adopting digital platforms to ensure continuity of care. To achieve these goals through our FLAG program, ASCOP focused on reducing new HIV infections among adolescent girls and young women. This work happens in schools, in communities, through mentorship to protect our family. When we empower a mother, we strengthen a nation. Ladies and gentlemen, our progress is tied to our partnerships. I acknowledge UNAIDS, World Health Organization, UNICEF, and all community organizations working with us. And I honor our host, the First Lady of Ghana, Her Excellency Lodina Mahama, who once said, "A generation free of HIV is not a dream, it is a decision." It is fast approaching. The world is watching what Africa will achieve, and our children are counting on us. Let us integrating HIV, syphilis, and hepatitis B services, stronger supply chains and community health systems, expanded adolescent stigma with truth and compassion. As I close, I'm inspired by the courage and determination in this room. Let us leave this meeting with more than declarations. Let us live with that will be protected. Every girl will be strengthened, and every family will be empowered. For our children, for our nations, and for the Africa we are determined to build. Thank you. God bless you.
Thank you very much, Madam First Lady of Kenya, Rachel Ruto. Thank you so much. Indeed, we will encourage early antenatal care for women to catch it early. Next, ladies and gentlemen, I'd like to invite to take her turn, her Lady of South Africa. Please welcome her with a resounding round of applause.
Your Excellency and my dear sister, Lodina Dramani Mahama, the First Lady of the Republic of Ghana, not to mention each one of you by name. It is no disrespect, but just in the interest of time. Today, at this important gathering, a convergence of dedicated advocates united by a singular purpose to protect the future of our children and mothers. I am filled with hope and determination, knowing that we are all here to continue. Our gathering today occurs under the noble banner of ending mother-to-child transmissible. It was my former assassin, Mandela, who said, any society which does not take care for its children is no nation at all. We are also poised to advance the triple elimination agenda, which aims to eradicate HIV. These are not mere words on collective action. The daunting challenge us are stark and heartbreaking. Thousands of children continue to be born each year with debilitating illnesses that could have been prevented and that are easily preventable. These preventable diseases not only jeopardize the health and future of our youngest citizens, but also hinder the progress of our nations. For each child born healthy is a promise for our future, a promise that we as leaders must collectively endeavor to fulfill. The path toward eliminating vertical transmission has seen monumental through comprehensive prevention programs and community engagement. We have made remarkable strides in reducing pediatric HIV infections. Yet we must, but a continuous journey that demands our persistent efforts. Strategies that have brought us success. The foundational elements, such as universal access to healthcare, integrated care services, and community involvement, we must deepen our commitment and embrace the triple elimination agenda, recognizing that HIV, syphilis, and hepatitis B share common routes of transmission. We must therefore advocate for simultaneous screening during the first antenatal visit to ensure that every mother receives essential care from the outset. Additionally, utilizing robust, data-driven strategies will enable us to identify the gaps, track progress, and tailor our interventions to meet the specific needs for our communities. These simple yet powerful interventions can change lives and significantly reduce the burden of these diseases on our healthcare systems. In addition to these practical measures, we must prioritize empowering our healthcare workers, the frontline heroes in this fight. These dedicated individuals offer essential services and support, often under challenging conditions. Investing significantly in their training, resources, and emotional well-being is essential for delivering not just care, but compassionate and effective care. As First Ladies, we have the unique opportunity to advocate for and support our healthcare workers and our healthcare workforce, ensuring they have of maternal and child health. We must recognize that our greatest strength comes from unity. UFLAD's aspiration for an AIDS-free generation and a healthier Africa cannot be achieved through solitary efforts. It requires our collective commitment, and we must perceive ourselves as part of an interconnected ecosystem. We must dedicate ourselves to sharing best practices, aligning our policies, and tirelessly advocating for sustainable funding. Together, our voices can create a powerful ripples of change, resonating well beyond this room. And I think the previous speaker, Atik, who said our proximity to power gives us that edge to advocate these issues to those that are occupying of the legacy and vitality of our children, which is our greatest asset. For decisions we make and the action we come, perhaps one of the most daunting tasks before us is addressing the stigma that often the stigma head on, strengthening a culture of acceptance and understanding. By doing so, we are empowered to seek the care they need without fear or shame. It is only through inclusive dialogue that we are accessing healthcare. While my term as First Lady may have concluded, my commitment and indeed my lifelong mission to the health, dignity, and empowerment of women and children across our continent remains unwavering. Therefore, I will continue to work alongside all of my sisters in Africa, advocating for a future where no child is born with a preventable disease. Let me conclude expressing my gratitude, my deepest gratitude to Her Excellency, Madam Lodina Dramani Mahama, for her excellent leadership, which leadership is not defined by the term in office of His Excellency, President John Dramani Mahama, where she tirelessly to build a future where otherwise it will be an indictment on us. I believe it was Mahatma Gandhi who said, and I quote, "The true measure of any society can be found in how it treats its most vulnerable members." Therefore, let us leave this meeting infused with renewed vigor and determination. I thank you.
My name is Emilia Mensah. I'm in Form 3 from St. Mary's RC Girls Basic School. My favorite subject is science, and I want to be a medical doctor.
Opportunity to select 20 girls for MEC in conjunction with Lodina Foundation. What happened was that we had to look through for brilliant but needy students who are challenged when it comes to educational needs.
I was in Form 2 when I had a scholarship. Before I had a scholarship, there were some difficulties in learning because I lost some of the textbooks I didn't have.
School wasn't too good for me because I wasn't concentrating too much on my studies because of my leg. My parents find it difficult, so I have to purchase my fellow classmates to learn with them.
But now I have them, and I'm hoping to learn harder than then.
After I was given my scholarship works for me, so I was able to learn at any time.
After the scholarship was given to them, the first thing, when we look at the
Lodina Foundation and MEC Foundation for giving St. Mary's students this opportunity. We are very grateful.
I'm very grateful to the Lodina Foundation and the MEC Foundation for giving me this scholarship because to achieve my goals.
So, on behalf of the beneficiaries, I want to say thank you to the MEC Foundation and Lodina Foundation for this show of love. And we hope that the scholarship will not end at the basic level, but they will be catered for up to the university level. Once again, we say thank you.
Thank you so very much. Another round of applause. All our first ladies for the great and wonderful presentations they have shared with us this afternoon and their various commitments to act. We appreciate it. Let me announce, everyone on your table, you would have been giving a copy of this brochure. It has the profile of all our first ladies who are here, who have spoken. Please read about their work and beyond. From the ambassador of the Arab Republic of Egypt, a paper on Egyptian national efforts related to eliminating mother-to-child transmission of HIV, syphilis, and hepatitis B virus. If you also do receive those reports as well. Let me also acknowledge the support of ICASA at the Secretariat and the SAA Secretariat as well, and ICASA Director who made sure that at every ICASA we have an OFLAD high-level event. Please give them a round of applause. And whilst I invite the guests, I'd like to invite all of us most respectfully, because we've been sitting for a while, just get up and stretch a bit and then sit back. For health reasons, just get up, shake yourself a bit, stretch a bit, shake somebody's hand, take your phone and take a selfie in just a few seconds. Take a phone, take a selfie whilst I invite on stage the next panel. I'd like to invite the facilitator for the next panel, Professor Kwesi Tope, Dean, University of Ghana School of Public Health. Prof, do you want to invite your people or should we keep? Great. So I'm going to hand over to you.
Come here for minutes now. Okay. Okay, so good afternoon, everybody, and welcome to this technical session. Her Excellency, Madam Lodina Mahama, our host, distinguished Her Excellency's First Ladies, colleagues, I would at this point invite our panelists. We have, hello, I think now you can sit so that we can get the session going. So whilst waiting, we can get our panelists to sit. We have Dr. Teresa Kaseva, the Director, HIV, TB, and Hepatitis from WHO headquarters. Then also we have in our presence my colleague and friend, Dr. Doris Macharia, President of Elizabeth Glaser Pediatric AIDS Foundation, based in the US. We also have Dr. Shafiq Isaji, Senior Advisor in HIV from UNICEF. And then finally, we have Dr. Hassan Jibiya, the Technical Advisor to the First Lady of Nigeria. So, Her Excellencies, the triple elimination agenda is so dear to our hearts. And I say this because we have the knowledge, we have the tools, we have the interventions that can end this. And we also have the political will, and that has been amply demonstrated today. We really need to put our minds together, our thoughts together, and strategize, because we have to eliminate HIV, syphilis, and hepatitis B in our lifetime. It is doable, and we will do it. Now, for this technical discussion, I would really want to draw on the experiences of our colleagues who stage. I would then ask Dr. Kaseva, can you tell us about the progress to date and then the challenges that we face in the triple elimination of HIV, syphilis, and hepatitis B?
Thank you very much, Lady of Sierra Leone and President of LAD, distinguished ladies, gentlemen, leaders and colleagues, civil society community representatives. Thank you very much for this opportunity to be at this wonderful panel with colleagues and to share and to update you on the current situation and share the latest news on behalf of World Health Organization. Warm greetings on behalf of WHO and its leadership. We appreciate critical role of First Ladies and other high-level leaders who use their platforms to protect the most vulnerable. Your ongoing advocacy amplifies the voices of mothers and children, ensuring that these issues remain at the forefront of political agendas. Political declarations, of course, must translate into tangible results for children and families affected by HIV. This is really where true leadership is tested, by holding ourselves and each other accountable for delivering on our promises. While the world made historic, significant progress in fighting HIV over the past decades, we must acknowledge that children and adolescents remain at the disadvantage prevention, diagnosis and treatment. So the problems of HIV among mothers and children reflect systemic issues and inequalities in the global responses. Although, according to the latest data, children account for only 3% of people living with HIV, they represent as and girls living with HIV become pregnant, leading to approximately 100 to 20,000 new cases of vertically transmitted infant HIV, 100,000 congenital syphilis cases every year, huge number. 1.2 million new HBV infections, integrated women and new pediatric infections and AIDS in children. and it's entirely achievable through coordinated action, uptake of the latest WHO recommendations, targeted investments, and unwavering commitments. Our strength is also in partnerships. Another example of focused and dedicated partnership is the Global Alliance launched by WHO, UNAIDS, UNICEF, and partners in 2022 with the explicit goal of ending AIDS in children by 2030. The Alliance works with the countries' governments built on core principles, countries' ownership, community engagement, and multilateral cooperation, which, with shared responsibility for progress. To achieve and sustain elimination, we need support needed. Early diagnosis is essential for timely treatment and better health outcomes. We must strengthen testing strategies, including reaching children in hard-to, and they should be available at primary health care level, not specialized clinics serving adults. Closing treatment gaps for pregnant and breastfeeding women in recognition that these efforts begins with the mother and ensuring all women have access to testing and treatment. Every child diagnosed with HIV deserves immediate access to antiretroviral treatment. This is historically been one of the biggest challenges, but now we have tailored pediatric formulation and most recently the introduction of new formulations with one pill combining all the treatment fixed dose combinations, easy to take tablet with complete treatment that can be used for all children. This has been a major achievement, and we can no longer use the lack of pediatric medicine as an excuse for why treatment coverage is so low in children. Supporting retention in care is another fundamental issue that should be addressed. Adherence, such as family-centered model and addressing social determinants. Prevention of new infections is absolutely fundamental, but due to different reasons, due to lack of funding, it was underestimated for many years. Now, with this agenda, and make prevention essential part of comprehensive HIV care. And of course, addressing rights, gender equality, and structural barriers. That's why we expect from leaders commit to sustain funding, champion accountability, empower communities, foster innovation, and we can accelerate progress to reach our 2030 targets. They're well known, but we are especially excited that there are champions in countries moving forward. WHO validated 21 countries for different types of elimination. Recently, you know, from the African the region, we validated Botswana for the elimination of vertical transmission of HIV. We've validated Namibia for elimination of transmission of hepatitis B and HIV. And the most recent announcement, Maldives, for the first time ever, was validated for triple elimination. It clearly shows that this is possible. Countries are moving, and we are receiving more requests to provide this validation exercise. Our aim is to validate at least 100 countries by 2030, and I believe that African countries will be among the champions. So thank you very much for all your efforts, for commitment, for partnership, and yes, we believe we can do our best and eliminate transmission of mother to child of these major infections. Thank you.
Right, thank you very much. And I think one thing that comes out clearly, that you see the children account for 3% of persons living with HIV, but 30% of deaths. This is really unacceptable. So, Dr. Macharia, from where you sit, Elizabeth Glaser Foundation works in many countries around the world. And what do you see as the gaps, and what must we do to reverse this trend?
First of all, thank you so much, Prof. And Excellency, First Ladies, distinguished guests, ladies and gentlemen. First of all, for me, it's an immense honor to really join this very timely discussion on ending mother-to-child transmission, and especially the triple elimination of HIV, syphilis, and hepatitis B in Africa. some of you don't know too much about Elizabeth Glaser Pediatric AIDS Foundation, but we were founded by a mother just like many of us here who was living with HIV and was fighting for her children. And as far as I know, we are probably the only organization that is dedicated towards ending pediatric HIV. Advancing triple elimination of HIV, syphilis, and hepatitis B, 3 diseases that we had even earlier this morning that share a common transmission path, are associated with significant maternal and child morbidity and mortality. And it's therefore a very natural extension of our own mission in our organization, the Elizabeth Glaser Pediatric AIDS Foundation. So to have triple elimination being prioritized by Your Excellency First Ladies and all of you here today is just signifies the importance, but also the urgency for action for children, adolescents, and mothers. As you've heard by other speakers, including the MC, Professor Tope, children living with HIV account for about 3% of the total number of people living with HIV, yet they are disproportionately account for HIV has stagnated over the past decade. It's hovering about 81 to 84%, and we need it much, much higher. More than a third of adolescents who are aged early, children, and for the elimination of not only, but also. The good news is that neonatal care with treatment and vertical transmission can therefore be avoided. So, Your Excellencies, the integration of, first of all, with our organization as EGPAF, we are with a presence in 13 countries. We have been extensively working directly with Gaia working, and what we realized is that that hasn't changed even today. There are persistently operational bottlenecks that continue to hinder successful integration of screening and treatment protocols for all these 3 diseases into routine service delivery, but into the antenatal clinics. While most countries report a very high uptake of at least 1 antenatal visit, many women still come late. They are very late after the first trimester, usually into the second and even into the third, which means that we often miss the critical window for early diagnosis and prevention, especially for HIV and syphilis. The second aspect and the second challenge I'd like to draw your attention to is the fragmented and uneven availability of diagnostics. HIV and syphilis right now is more or less policy in many of the countries, and we're practicing dual testing of moms and of course of kids as well. But hepatitis B continues to lag behind. Often it's unavailable in rural areas, it's inconsistently offered, and when it's offered, moms and families are incurring high out-of-pocket expenses. And even where HIV and syphilis dual testing exist, costs and stockouts remain barriers. I think another thing to just highlight who needs prophylaxis is a challenge. The third one is, I think as earlier mentioned, is the supply chain and treatment constraints. I think most of our African countries have there's a drug which may be effective, it's Givrock in sometimes, and there are also stockouts of tenofovir. There's also limited rollout of hepatitis B birth dose vaccine that remains a challenge, and this is really critically important. You have a 24-hour window for babies to receive hepatitis B vaccine, and if you miss that window, then I think fourth for me is really integration remains incomplete. I know we've been talking about it quite a lot, and integration of HIV services into other health services, into the maternal and child health platforms is really important, and it's right now the discourse. But only a minority of countries have fully integrated service delivery or technical working groups where all these 3 diseases are being discussed, are being supported, and also services are being delivered. Although the global guidelines are and fully implement points of care for early infant diagnosis of HIV, for instance, and partner coverage and logistics also vary. I think for me also, coming from our beloved continent, I think it also saddens me quite a bit when we find women have to navigate fragmented health systems. Here's a pregnant woman, she's having to navigate many, there's also a lot of user fees. A number of our countries have not waived user fees for pregnant and breastfeeding women as we would want, which leads to a lot of losses of follow-up, retention of care, which is poor, and also especially of the families is simple. If services are not available early, and they are not available together and reliably, we will continue to see these preventable infections, which we can do something about. As we've had before, we've got the tools, we've got the approaches, we've got the health systems to deliver triple elimination in a reliable and consistent way. Thank you.
Right. Thank you very much, Dr. Macharia. I think over and over again, we are hearing about integration. One individual, multiple risks. Dr. Saji, how do we drive integration, particularly in the primary care setting, to address HIV, syphilis, and hepatitis B?
Thank you very much. Is this working? Yeah. Okay. Thank you very much, Prof. And Your Excellencies, thank you so much for the invitation to speak at this forum. It's extraordinary to listen to you. I might say that I expected to hear some diplomatic protocol, but what I heard instead was actually profound commitment, a deep passion for this work, and I found it really very, very moving. So thank you for your efforts as well as for your advocacy on behalf of a cause that we all believe in so greatly. We have learned so much over the last 20 years, and we've come really a long way because we now have systems and services that are delivering very high quality care to mothers and children living with HIV. This is very technically challenging, it's complex, it requires, but we've been able to do it, and we've been able to do it in every country across the continent. This care is compassionate, it is care that is consistent and that is reliable. And that is no mean feat in the context of a public health system that has been long underfunded. So we've done an incredible job, and we know we've done an incredible job because something like 67% of children are virologically suppressed, and we have saved over 4 million children from acquiring HIV because of the efforts to prevent vertical transmission. So how amazing would it be if we could take all of these incredibly high quality services and deliver them to all mothers and all children in need, not just the mothers and children living with HIV. We've started there, but we've learned so much, and now we can expand to a much broader canvas. Now, it's a lofty ambition, certainly, but it's absolutely possible, and we're already seeing it with the shift from HIV PMTCT to triple elimination. It's not just prevention we're talking now, it's an elimination, and it's not just one disease, to a much broader focus from one population to a broader population of mothers and infants, and apply that to the way in which we deliver care for children. What we've learned over the years could be an incredible way of managing not just HIV, but all chronic illnesses at primary care level, whatever they may be, whether it's infectious conditions like HIV or hepatitis B, or tuberculosis, or whether it's non-communicable diseases like diabetes or sickle cell disease. These are also going to be incredibly important in the future. Already, among adults, non-communicable diseases are driving something like 60 to 70% of mortality, and we will see the same thing happening for children. And I think it behooves us to think a little bit about what we need to build for the future. We don't want to have another OFLAD dedicated now to ending non-communicable diseases in children. We can see that future coming, and I think we have the tools and we have the skills to be able to avert that from happening. And there are also already great examples from the field. In South Africa, in the KwaZulu-Natal province, primary healthcare systems are designed according whether they are acutely ill or whether they have a chronic condition, and managed in the same service with the same skill set and the same commodity supplies that can ensure that they have high quality services. In Malawi, the government, in partnership with other stakeholders and implementing partners, has modeled a new delivery system which they call IC3. And they bring all of that expertise from HIV and with other chronic conditions that require care and treatment. So I think this is a challenge for us of trying to figure out how we can expand and integrate these services, but it's not a panic response to the current funding crisis, right? It's something that has been happening for a long time, and it's something that we should be doing. It's the right thing to do to extend the services that we offer to mothers and children beyond those living with HIV. As well as they do for HIV, I think we could change the future for Africa's mothers and children. As HIV itself becomes a lifelong manageable condition, services for children need to evolve into a long-term integrated platform. The same healthcare structures, but many more people served. So it's about transformation for a primary care platform for...
Once upon a time, Nigeria, about 10 years ago, Nigeria was one of the countries with the highest burden of pediatric HIV, and I happened to work in Nigeria for many years. And we have seen a significant shift in Nigeria and then also Central Africa region. Actually, it is the best. Now, can you tell us the experiences that you've had in terms of advancing the triple elimination agenda? What can we learn from you?
Thank you so much, Professor Topi, for that introduction. Your Excellency, thank you so much for hosting us, Madam Mahama, and other excellencies that are also here. As you have heard from Professor Topi, that Nigeria is doing very well when it comes to its progress towards this and hepatitis B. It was in 1986, and since then the story has been about progress and also resilience. We have currently about students of Her Excellency, the First Lady of Nigeria, Her Excellency Senator Oluremi Tinubu, were able to launch the Free to Shine campaign, not just in Abuja, but in 6 geopolitical zones within the course of 6 months. That is how aggressive we go when it comes to HIV/AIDS. And Her Excellency was able to follow us after the planning sessions, which we integrated both local and international stakeholders. UNAIDS was there with us. Dr. Nandos, who is also all the other states that are within that zone, all the stakeholders, local government chairmen, traditional rulers. It's very important to pay homage to traditional rulers wherever you go, because they play a key role in disseminating this awareness campaign to their people. Believe it or not, people still listen to traditional rulers. So we carried them along. We invited people, the network of people living with HIV, to come to our sessions, and Her Excellency will stand up and greet them and embrace them. That helps a lot in also, putting down some of the stigma that is, pervasive in our communities. And also, one interesting method that we also adopted during the campaign was to present zone data-specific analysis, basically performance review of how a particular state is doing when it comes to taking in ANC services or also PMTCT services. States that are not doing so well, they're being called and attention is being driven to particular areas where they're not doing great. That has helped a lot. And due to that rigorous campaign, our strategy was always find all pregnant women, test all and treat all and report all. Because when you do that, then you have coverage of, so that is our the model that we use. And as a result, experts in the field are telling us that the numbers of ANC, mothers seeking ANC services has gone up. The numbers of mothers also seeking prevention of mother-to-child transmission has also gone up. Challenges still remain, as we know. Funding is an issue. My colleagues have spoke about how we're having value chain issues with the, for example, when it comes to hepatitis and syphilis, there's always this stock-out issue that we always suffer, you know. Even expertise, there's skill gap when it comes to syphilis and hepatitis B. Wherever you go, weekend services are always a problem. These are things that we identify in the field. And partners refusing, male will refuse to come to, a clinic to get tested. You know, I was telling my colleague, I wish all men were like me. They listen to their, women. You know, but thank you, Excellency. But that's also another critical issue that we discovered, that partners, there's a lot of missed opportunities of prevention when you have the pregnant woman attending such services, but their partners are refusing to join. Thank you very much, Dr. Chokwe.
Thank you, Ogajibi, the Stop Academy, the man. Okay, so I'm going to change the format a bit. I really want us to engage because of the time, so we have to be mindful of that. So to the audience, questions, comments, and keep it short and sweet. We say you kiss it. Keep it short and sweet. Your name and then.
Okay, thank you very much, and it's been really insightful this of December as a country, and long-term strategies in mother-to-child, how we look at this in the country. Thank you.
Any more questions?
Let me tackle it, because I think what you're talking about really makes sense. I mean, we want to make sure that as we are looking at a mother and child, as an organization, we like to look at mother and child as a pair, so that we are able to track their own outcomes, not only from the health service, but also into an educates of a child. So there is that sort of continuum when you're thinking about how do we make sure that we can eliminate HIV, syphilis, and of course hepatitis B, and that will ultimately improve early childhood development, and will ultimately be really important, because at the end of the day, that's why we are doing what we are doing, is really making sure that the child can survive beyond the 1,000 days and get, as you were asking the question, that it's important to make that connection and that linkage, that we shouldn't see the health outcomes as being siloed to the education outcomes, but we need to intervene as early as possible with good diagnostics, with making sure that women can come into the clinic as early as possible to get tested, to get treated, and to make sure that if she is living with HIV, she can also get
Look, there are 4 doctors up on this podium, but as our distinguished First Ladies have reminded us, HIV is not just a medical problem, and the solutions are not just medical solutions. Already something like 25% of all pregnant women living with HIV are actually adolescent girls and young women. So there's a problem that we are not doing enough to protect adolescents from acquiring HIV in the first place. 7 out of 10 new infections are occurring among adolescent girls on this continent. We're not doing enough to provide girls with the pregnancy. And I think education has been shown to be the vaccine that both prevents early pregnancy. Hope that other countries will follow.
Good, thank you.
If I may also to contribute, yes, we've been focused mainly at this panel on health system problems, but of course this is far beyond, and knowledge gaps we are observing are critical, and they should be addressed with the joint efforts with the youth engagement. Maybe we should rethink our traditional communication strategy, and it's possible, but we should just stop doing business as usual and be a little bit more innovative.
Okay. No, I'll come back to you. So, thank you very much. And I like that education is really, really a vaccine. So, at this point, what I want all of you to take away from the presidency here. So, you start, and again, keep it short and sweet.
How many hours do I have? How many hours?
Hours. 2 minutes.
Your Excellencies.
Okay.
Let me hit on the last note, which is about education. In Nigeria, it's be translated in both English and local languages and be distributed into hospitals, because there is a lot of lack of awareness. Most parents, that HPV birth dose is very important. Most of the mothers do not know when to get tested. So information is key, and we have to do our best to relate that information to as remote. And finally, Your Excellencies, ladies and gentlemen, 2030 is not 10 years to come. It's not even 5 years to come. It's just 4 years and 17 days to go. The time of action is now. Let us double effort and find all pregnant women, test them all, treat them all, and report them all. Thank you very much.
Thank you. Test them all, treat them all. Shafiq, your closing remarks?
Yes, the smell of rice is wafting from the back tent. I don't know, is it jollof rice? Is it Liberian jollof rice? Is it Ghanaian? It must be Ghanaian jollof rice, for sure. And it smells delicious, so I don't want to keep you. But let me close by saying we are speaking to the converted here. We all believe the things that we are saying to each other. What we need to do is start making ourselves relevant to a broader audience that maybe doesn't care so much about HIV or doesn't think that it's that important for the country. But I think what we have learned and done in the HIV space, the way in which we have community involved, and not just involved, but leading the systems that are shining examples of how any of us would want to be treated if we had a health problem. And I think at this time when we're a little bit on our back foot because funding is scarce and everybody's saying, aha, now you people are coming of how things should be done. So let's expand the way in which we deliver services for people, by people themselves getting involved with that service delivery space. And let's use that for the benefit of all mothers and children. Thank you.
Thank you. Dr. Macharia?
Yeah. First of all, I want to just, as I was preparing for this session, I'll be 2 minutes. I was remembering at the earliest time of the epidemic, working as a physician in a slum in Kibera in Nairobi. And one of the things that really resonated with me at that time was services being delivered close to where communities are at primary health care level. So even as we are thinking about triple elimination, from testing to providing the treatment and getting the services, we have to think about how do we make sure these services are provided at primary health care level. And therefore we can reach more, we can baby pair. The more we can think about the mother is always joined with the baby anyway. The more we can track those longitudinal outcomes, both for moms and children, the evidence that we generate at primary health care level and elsewhere will actually inform us in terms of the decisions we need to make. The collaboration and partnership, because this is why we have gotten to where we are, and we hope that you continue shining that light and opening the pathways for us as we continue serving and advocating for better outcomes for children, moms, and families. Thank you.
Dr. Kaseva?
Yes, I will try to be brief. And now my turn to share my words of appreciation to all the Excellency First Lady of Ghana, all the other Excellencies First Ladies. You are doing a great job. Please continue your unwavering lead. First, we have to recognize that future is not tomorrow, it's already today. And things change already dramatically. And the only one way to bring services closer to people through integrated approach. We've done a lot with vertical focus, and it was at that time really very much needed to focus on diseases and push heavy agendas. Now we are at the time when we should bring together all the experiences into the integrated services and make them closer to people. Second message is we should not underestimate prevention. To prevent is always cheaper than to find and treat. Just a quick example, if we are missing birth dose of hepatitis B, then 90% of children will for sure develop chronic hepatitis, underestimated. Primary prevention should become flagship in all the countries. And third message, innovations. So we are living in the era of a lot of amazing innovations, shorter, faster treatment, diagnostics.
Thank you very much, Dr. Kaseva. So I must say that eliminating HIV, syphilis, and hepatitis B is feasible. The interventions are for the hepatitis B birth dose, and education came out addressing the mother-baby pairs. So these are all very important. It's also on its way, and I think all the African countries can follow suit. With these few words, colleagues, join me to thank our panelists for an insightful session. Thank you very much.
And join me, Dean, University of Ghana School of. At the end, I would like to invite now FLAD and SAA towards the Global Alliance to End AIDS in Children, triple elimination of HIV, syphilis, and hepatitis B, and increased domestic financing. So, OFLAD Secretariat, yes. Please give a round of applause.
Good to read the communique of this high-level meeting on the triple elimination of HIV, syphilis, and hepatitis B. We, the African First Ladies, meeting on the margins of the 23rd International Conference on AIDS and STIs to achieving an AIDS-free generation and ending mother-to-child transmission of HIV, syphilis agenda, we have cultural barriers and insufficient domestic financing. We also recognize the unique leadership role of First Ladies in mobilizing political will, galvanizing communities, and advocating for sustainable investment in maternal and child health. Key commitments. 1. Political leadership and advocacy. We affirm our collective political commitment to eliminate mother-to-child transmission of HIV, syphilis, and hepatitis B by 2030. We pledge to leverage our platforms to influence national policies and strengthen political ownership at the highest levels. 2. Strengthening health systems. We commit to supporting governments in integrating and sustaining pediatric HIVs. We will advocate for equitable access to quality service for women, children, and adolescents, domestic financing, and sustainability. We call for reforms to increase sustainable domestic financing for health systems, ensuring resilience amidst global economic challenges. We will champion innovative financing mechanisms to reduce dependency on external aid. 4. Partnership and multi-stakeholder collaboration. We pledge to strengthen partnerships between governments, civil society, communities, and development partners to advance the Global Alliance to End AIDS in Children. We will promote inclusive engagement of women living with HIV and community-based organizations in decision-making processes. 5. accountability and roadmap to 2030. We endorse the development of a clear roadmap with priority actions to achieve the 95-95-95 targets for transparent reporting to ensure accountability at national and regional levels. We, with HIV, syphilis, or other, we will continue to champion the health and rights of women and children, ensuring that Africa leads the way in achieving the global goal of an AIDS-free generation. Issued in Accra, Ghana on 4th of December, 2025. Thank you, Excellency.
And let the people say amen. Thank you so very much. And without further ado, the Chief of Staff at the Office of the President, who is also the technical advisor to the First Lady of Ghana, Her Excellency Lodina Mahama. But the person to do the remarks is the Honorable Nana Oye Bampo Ado. Please give her a round of applause.
Thank you, guests, ladies and gentlemen. See Lodina Dramani Mahama. I extend our deepest gratitude to you all in the response to HIV and mothers by 2030. Our sincere appreciation goes to Honorable Dr. David Payeng Yatwa, President of the Society for AIDS in Africa, for your steady leadership throughout the day. We also thank Ms. Rhoda Kofi, National Secretary of NAPLAS Ghana, and Her Excellency Ms. Winnie Bayima, Executive Director of UNAIDS, for your powerful contribution of our distinguished First Ladies from Africa. Her Excellency Mrs. Lodina Mahama, Her Excellency Dr. Bokai, Her Excellency Mrs. Rahel Rutu, Her Excellency Mrs. Fatumata Baro. We receive Tobika Madiba Zuma, former First Lady of South Africa. Indeed, your presence powerfully. We are also especially grateful to the global and continental experts whose technical presentations strengthened our collective understanding and our action. Together, these discussions call commitment and accountability are the highest pediatric treatment services and increased investment in resilient health systems and community leadership. OAFLAT Secretariat, thank you very much. Society for AIDS in Africa, our development partners and cultural performers whose excellence enriched today's gathering. We say Ayiko to you. Special appreciation also to Dr. Nados for leading the adoption of our joint communique. Finally, to all our participants, your engagement today strengthens our resolve and deepens our partnership. Together, under the leadership of our African First Ladies, we move closer to securing a healthy, AIDS-free future. Thank you very much, and God bless you all. Thank you.
Thank you so very much, Nanoye Bampoado. So indeed, you did not imagine it. Lunch is served right behind you, and lunch is definitely ready. And so on cue, and then the ushers would usher you to where we're all going to have some really sumptuous Ghanaian jollof, award-winning with your kind cooperation. Enjoy the rest of your day. Thank you.
You've been gone.